Hello, everybody. Another episode of Tameless podcast. But today we got a special edition. I have two great hygienists with me, Megan and Sarah. They both work as a hygienist. They graduated a couple of years back with experience. So today we're going to talk about the journey of hygiene and all that fun stuff. So welcome, guys. Thanks for coming out.
Thank you for having us.
Yeah. So let me just give a little briefing about what are we going to talk about today. We're going to dive into why they became a hygienist, the real life challenges behind being a hygienist, the money side, the work life balance, the future looks like for them, and their own experience on why picking the field. So let's start. Give us a little introduction about yourself.
All right. So my name is Sarah. I'm 23 years old. Originally, I'm from Newfoundland, a little province inside of Canada. I left
Shout out to Newfoundland.
I left Newfoundland right out of high school. I remember my grade 11, grade 12 year, I was trying to figure out what I wanted to do. And then my mom actually did bring the idea up to me of dental hygiene. One of her friend's daughters were doing it, so I looked into it. Funny enough,
Wait. Take me back a little bit. Now.
Okay.
So you graduated high school.
Okay.
And then.
So before that, I was trying to figure out what I wanted to do. So I always knew that I wanted to go into the medical field, and the first thing that came to my mind was to be a nurse. And then.
What drives you into the medical field?
My grandma is a very important person in my life, and she was a nurse for like 40 years, and that was kind of my first initiative of like, I want to be like my grandma, I want to follow in her footsteps, and like I want to be a nurse, I want to make her proud, right? So
okay.
I started like
so not to help people
and to help people.
Okay.
So I remember like reading into it more as I got a little bit older, starting to kind of understand a little bit more of like what a nurse does, like the hours you have to put in. Like they work in hospitals, they work all these long days, they work their holidays, and I was like, I don't really know if that's something I want to do, especially as I get older. I'm gonna want to spend holidays and things with my family.
Okay.
So then my mom came up to me and she was like, why don't you go into dental hygiene school?
So your first exposure for dental hygiene school
was my mom.
Okay.
Yeah, I've like even going as a kid to the dentist, like you don't really think much of like who's actually cleaning your teeth, right?
Wait. Shout out to Sarah's mom.
Shout out to mom. So yeah, I kind of looked into it. Funny enough, I had a dental appointment like literally the week after she brought that up, and I kind of went in and I was talking with the girl. I'm like, okay, you're the hygienist. Okay, tell me like what your day-to-day looks like. And then I was like, okay, this is something that I feel like I would be interested in. Kind of just shot the bullet, reached out to the school that I searched up all these schools across Canada. The one that I went to in Ottawa was called CNIH. It was
shout out to CNIH.
Shout out to CNIH. So the thing that drew me towards coming to Ottawa to begin with, obviously dental hygiene school, and then how the program at CNH is only
so why Ottawa?
So I was looking all over Canada. Most dental hygiene programs are 3 to 4 years long.
They're degrees.
Yeah.
Okay.
Mm-hmm.
So I was like, okay, like that's not bad. Nursing school would be roughly the same, maybe even a little bit longer. But then one of my friends of a friend was like, hey, this girl's actually in dental hygiene school and it's only a year and a half. So I was like searching on the internet. I was like, where is this school? What is this? And then I found out it was in Ottawa. And then I was like, a year and a half, like that's perfect. And I'm going to be literally 19 by the time I start working. I'm like, let's go.
Yeah.
So I found the school, sent out an email, basically started the whole process of having to do an entrance exam and also like a mature student exam. These are just 2 exams that you'll have to face to go into hygiene school, and that's kind of pretty broad of all schools.
Yeah, we're gonna get to that.
We'll get to that. But so did the process, started studying, did the exam in my first month of my grade 12 year, passed, and I was like, all right, waited the full year. It was actually in the middle of COVID.
Really?
So my grade 12
Okay.
year was like 2020. So we
Okay.
actually finished in March.
Did you have a prom?
I did not.
No prom, eh?
No
No
prom.
problem.
So yeah, that kind of sucked.
Yeah.
But I was like, it's okay. I'm gonna go to hygiene school, and yeah, basically graduated high school, hopped on the plane, came to Ottawa, and started the journey.
That's great. That's great. Yeah,
Yeah.
good experience there. What about Megan? Give us a
So-
little background.
Okay, so my name's Megan. I'm 25 years old. I've been a dental hygienist for just over 2 years now. Originally, I'm from Windsor, Ontario, so it's right on the border of Detroit. It's a pretty small city in Canada.
Wait, we gotta give it a shout out to
Shout out to
Windsor.
Windsor.
Yeah, I don't know if they deserve the shout out. It's about as small as a city as it gets, but it's home.
It's
So
home.
yeah, I'm the oldest daughter in my family, so I have 3 younger siblings. So
A
growing
lot of
up,
responsibility.
a lot of responsibility, a lot of caretaking. My little sisters are actually 10 years younger than me, so I did a lot of like raising them, taking care of them. And it was kind of through that I knew that like that was one of my strengths, was caretaking.
That's great.
Which led me to the medical field of some sort. So my interests were definitely in science, and then coupled with that, those soft skills that I knew that I had, I knew that that was the path that I should take. So Windsor, being the small city that it is, didn't have great opportunities, so I knew I wanted to go somewhere else. My now husband and I moved to Ottawa in 2018, and I did do a couple years at U Ottawa in biomed,
That's great.
which I didn't do great in.
So you moved because you got accepted at U Ottawa.
Yes.
Okay.
Yeah. So I did 2 years there, and then I decided to take a gap year where I was like, you know what, I need to really figure my shit out, figure out what I want to do.
2 years in biomed.
Yeah.
Wow.
Yeah. And then I took a gap year and I worked at a daycare during that time, which I actually really liked. Love kids. Again, I feel like it's one of those things that I just naturally kind of gravitate towards, like taking care of people.
There you go.
But it's super undervalued in terms of like you're taking care of the next generation, but they do not get paid very well.
True.
So I had to explore the options. So I remember one day I was like, okay, I need to make a decision, go back to school. So I was looking at the programs at Algonquin College, and I was stuck between dental hygiene, respiratory therapy, and cardiovascular tech.
Okay, 3 great.
Yeah,
those are
All
good.
great fields. And I was like, let me look at salary and let me look at the demand for it. Because I feel like so many people my age go
Okay.
into a program.
You did your research.
I did.
There was
Yeah.
research involved.
Yeah.
I felt like I was running out of time. Like at that point I was 21 already. So I had done a couple years. I'd invested a year into like a career that kind of was going to be a dead end for me, like didn't have a lot of growth potential, the early childhood education. So I was like, I need to make a good decision for what I'm going to do next. So I did do a lot of research, and at that point in time, which we've spoken about a lot, it was the dental hygiene field after COVID. Really, there was a shift in terms of salary and in terms of demand.
So you made that decision after COVID.
Yeah, so when I
Okay.
applied, it was 2021.
Okay.
And that's when I started, was September 2021. And then I
Okay.
graduated. The Algonquin program is a little bit longer than the CNH program. So I graduated December of 2023.
Why Algonquin? And this was before you moving to Ottawa?
I was in Ottawa
No,
already.
Okay.
Yeah.
You were in Ottawa.
So
already,
moved
yeah.
2018, did my 2 years
2
U
years.
Ottawa, took my year off, my gap year, and then
Decided
went back
to.
for
Okay.
Algonquin, yeah.
Yeah. No, that's and then why Algonquin if you were in Ottawa already?
Honestly, I didn't even really consider CNIH. It was like my husband had been to Algonquin for mechanical engineering. And I think that the nice thing about college programs that a lot of people overlook is you do your program and then you go right into whatever you studied. Whereas I feel like a lot of university programs are so broad that there are a lot of avenues you can take. It's not so direct. So I kind of was following, I guess, his path, the path that he took, and was very successful in. Because he got a job at where he co-opted. So
Okay.
Yeah.
Which is a good entry.
I
to
just
the
wanted a
field.
job. I was like, I need to start working
Yeah.
for real.
Yeah.
So
No, it makes sense.
yeah.
So okay, Now, we talked a little bit about intro. That was a good introduction, guys. I
Thank
know. Megan, a lot of research was done. Sarah, you got exposure from your mother and you looked into it. You decided that this is a field you want to jump into.
Yeah.
So now take me through the process of preparing to enter the hygiene school. Well, I know that first of all, it's expensive, right?
Yes.
So I want your feedback on the steps that you guys take. Let's say I just graduated high school.
Mm-hmm.
I decided that, dental hygiene is for me. Now, how do I go about this?
So, yeah, we'll kind of go back to the beginning of just basically what was kind of going through my head at the moment. I just knew that dental hygiene, I was like, I'm going to apply. I don't know how I'm going to figure this out. I'm just 18 years old in high school, but I'm like, I know that that's what I want, so I'm just going to figure it out. I don't know how, but I'm going to do it. So, especially growing up, I had little side jobs here and there, but nothing consistent. I was very heavy into sports and things, so I didn't really have much time to work. So I'm like, I don't really have much money saved up. Come from a very small place, I'm just living with my mom. And then when I moved to Ottawa, of course, you have to go through the whole process of getting student loans. That's pretty basic. Most people can't just afford things out of their pocket. You do have to go through that process. And actually, at the time, my school wasn't designated for student loans. So
Okay.
I was set back. I was like, well, what am I supposed to do? I want to go to this school. I want to be a dental hygienist, and I'm not going to let this stop me from not doing what I want to do. And at the time, when you're underage, I was like 17, 18 at this point. It was like the beginning. So I'm not going to accept, no one's going to give me a credit card. No one's going to give me a line of credit.
How bad was your credit?
I didn't have a credit card.
Oh my
No
God.
credit.
I was
Zero.
set. I was
no
17,
credit.
so no credit. And I remember the day I walked into the bank and I was like, things are gonna be great. Things are gonna go so smooth. And I was like, I'm here. I need a student line of credit. And they look at me. They're like, how old are you? I was like, I'm 17. They're like, you better walk back out that door. And I was like, oh, so this is gonna be a little bit more challenging.
So what did you do?
So funny enough, a week go by and they send out an email. They're like, okay, this is the amount that is going to be due before this date. I don't remember exact dates and timelines, but I remember sitting there and I'm like, I have a week to make this happen, because they don't take monies like semesters. They don't take $2,000 a semester. That it's a lump sum.
Oh,
now, when I went to school, it was cheaper than what it is even now.
Yeah.
But I was like, okay, if it was that lump sum, it would be able to figure it out. But I'm like, I have to make $16,000 payment in a week. Well, I'm not. How am I going to figure this out?
So what did you do?
So once again, shout out mom.
Wait, hold on.
We gotta give shout out mom.
Still working on my skills.
My biggest supporter in life, and she was like, we're gonna figure this out. You got this. I want you to. I really want you to do this. She makes a couple phone calls to people that she knows that's kind of within that scope of student aid, all of that sort of deal. And next thing you know, we get a call and we're like, your school's designated for student loans. Go apply and put the application in right now.
Okay.
So that's when I was like, oh my God. So I apply and I get the money. And this was days, 2 days before the deadline to have that money in.
For your application?
For the application.
Okay.
So then, yeah, after that payment.
So how much walk me through it. So
Okay.
This is the financial aspect. So preparing, what do you think, Megan, how did you get yourself prepared for dental hygiene? I'm a 19, okay, walk me through it. I'm a 19-year-old, just graduated,
Mm-hmm.
and I want to apply. What do I need to be worried about?
Right. I I think you would have to look back to what courses you took in high school, first of all.
So they really care about that.
They do.
Yeah.
They do care about that. Even as a mature student, you have to have taken like your grade 12 math, your grade 12 sciences, your grade 12 English, and or whatever language you're going to be practicing in.
Okay.
And they want you to take, there are certain tests that you have to take. Like I remember taking, I think it was like math, science, and an English test.
Okay,
And like
so
they aren't,
math, science,
Yeah.
English test.
they're pretty basic. If
Yeah.
you've taken those courses in high school, you can pass them. But if
Okay.
it's been a minute, you'll probably want to refresh a little bit.
How long is it refreshing?
I think I maybe like looked a few things up, but I was also like, I was only a few years out. I had done a couple years at U Ottawa, so a lot of the stuff I had learned in that time was much more advanced than what they
Okay.
were asking. But if you are like, if you haven't taken all those courses, you're going to want to take some sort of pre-health course.
Okay.
100%.
So it will. So if you didn't, what you're saying is that if you graduated for a while, it's
Mhm.
better for you to take some courses before you do that exam.
Not necessarily
12.
if you like if in high school you opted out of sciences and you opted out of maths, you will need to take a pre-health course because
To
you don't
refresh.
have what it requires. Not even to refresh, they won't accept you
Okay.
Yeah.
without it.
Okay.
If you took those and it's just been a really long time, I think that you can do your own sort of refresher. You would have to kind of seek out. I'm sure there are courses online that you can take.
Mhm.
But if you haven't taken those courses in I think it's grade 11 and grade 12, you have to take some sort of compensatory courses
Yeah.
to
So
Okay.
that's
catch up.
kind of like what I was saying about like the mature student test. Like for me
Mhm.
in high school, I only took biology, but they wanted you to have chem, physics, all of that. So then that's when they give you the mature test as an addition to your entrance exam.
Okay.
Yeah.
So you would have to do the mature test, pass that.
And then
then
you
do
do
your
the
entry
entrance
exam.
exam.
Yeah.
Exactly.
Walk me. Okay, so let's say the mature test, I got good grades in high school. I took bio, I took all the essentials. I know the subjects I need to study. I do that exam, I'll be fine. And then I go for the entry exam.
Yeah.
Okay.
I think so.
Now the entry exam is more intense than the mature student test. Like when you do the mature student test, it's very general, it's pretty basic, but then the mature or the entry exam goes a little bit more into detail, and that's something that you would have to study for.
Okay.
Like you can't just one day I'm just gonna go write this entrance exam because I did these courses in high school. Like you will need to make sure you got everything in line.
Makes sense.
Yeah.
And I know you guys both graduated from different colleges, so we're
Mhm.
gonna talk about that. But before jumping into it, just because I'm becoming curious about this. What do you think? What now the entry exam? How difficult is it for someone that just graduated high school? I'm not talking about the refreshing one that you did before. I'm talking about the entry exam.
Mm,
I think you have to know yourself. Like if you were a good
Yeah.
student in high school, it's not going to be very difficult.
Okay.
If you know that you were someone who before a test you had to study to pass that test, you had to put in the time, then do that. You know what I
Yeah.
mean? You're not it's not
100%.
something where it's not common sense. This is something where like either you have acquired that knowledge and retained it, but if you're not the type of person who can remember things off the beat of your head that you've learned maybe a year ago, then you should refresh yourself, especially considering if you're trying to apply for a program, you want to be invested in it. So take the time.
Yeah.
Take the time, go over it for an hour or two.
Yeah.
If you're going over it and you're like, I don't know this material, go over it more.
Okay.
Spend a day, like a week preparing yourself. But
Mhm.
you know yourself better. If you're a good student and you're confident in your abilities, I don't think it's something that you're gonna
have to worry
fail.
about.
Yeah.
Yeah.
Yeah, makes
sure.
sense. Now I want to dive into another topic. Before I go into that,
Mhm.
do you find that from an Ontario, you're exposed to like you can apply? How are the finance with getting into Algonquin?
So, speaking from my experience, I do come from like a pretty low income family. So I am privileged in that in Ontario they have OSAP. So a lot of my funding was grants. So I do still have student loans, but a lot of it was funded by the government. Not everyone is in that position. So it depends on your background, but it's
Mhm.
definitely something that you can look into. When I was in school, I also applied for private grants. So, and it's super easy. Algonquin makes it really easy to apply for grants. They'll have them all
Wait, I
listed
gotta give a
out.
shout out.
Yeah.
Algonquin.
Yeah.
That is amazing.
Yeah.
That makes it a lot easier.
It
Yeah.
does, and sometimes it's not a ton of money, but like when you're working 2 jobs and you're going to school and you have to pay rent next month, $200 is going to be something, you know.
Yeah.
So yeah.
No, it makes sense. This is, I think, one of the questions that a lot of people ask about is how do I deal with the finances of getting into hygiene school? Because I know it's really expensive, but it is really rewarding too.
It pays
100%.
off.
Yeah.
Yeah.
It pays off.
So now we got through the point of you entering hygiene school. I want to talk about both of you guys' experiences because I know you, Sarah, you did the 1.5 year program,
Mm-hmm.
so more express, more let's go, more night shifts, and Megan, you did more a 3 year program,
Mhm.
so that gives you more flexibility, but a lot of more hours. I want to know now. Okay, I made it into dental school. I made I made it into hygiene school. I made my decision. I want to start hygiene. I got accepted. I did my match. They accepted me. Now I'm gonna go into hygiene.
Mm-hmm.
I get my scrubs. Shout out to Figs.
Best day ever.
Just for the record,
Maybe-
you can't wear figs in
Yeah.
Algonquin.
No,
We can't either.
No,
Bro.
I put you in the mop scrubs, but do you know what?
Wait, shout out. Moms are good too. You know, a lot
Okay.
of doctors.
Yeah.
Algonquin has their own scrubs.
Are you serious?
You gotta pay them.
Our
for those
generation is like, you have to wear figs. Like, if you're not wearing figs, like, what are you doing? So, we're in school.
Wait. I didn't know about Figs until I worked
Yeah, because
with you guys.
scrubs. Really?
I swear.
you're an unk. Bum, bum, bum.
Shout out to Unks.
This one
So-
goes up to the.
So yeah, like we're young, we want, and then we get these scrubs, and I remember like, oh man, but it was so
ridiculous.
fun. Like it was like a whole new chapter, start of a new journey,
Yeah.
and yeah.
So
I
it's
was
good.
excited.
Walk me through it. So I got my mob scrubs on. I'm going into dental hygiene. I'm excited. I don't know anything about teeth. I don't know numberings. I don't know nothing.
Okay, this.
All right. And then first, give me like a brief of the first 6 months.
All right.
In 2
So, I feel like one of the biggest things about like dental hygiene school is for some reason, a lot of people think you have to have like a history in the dental field. You need to be an assistant so you can go into hygiene school, or you're going to do better in hygiene school because you were an assistant before. And that's not true. Like, I do believe to like a certain extent that like dental assistants, you guys know like how to take x-rays, you know mesial distal surfaces, you know how the office runs, you know how to do sterilization, you know certain things of like how to do notes. Like all of those are day-to-day things that someone like say me or you that never worked in a dental office before are like, what the heck? So that part can feel very intimidating at the start, but I feel like as long as you just keep reminding yourself that we're all here doing the same thing, and that we're all going to end up at the end of the tunnel and everyone's going to be an RDH.
That
Yeah.
used to be the pathway. So, like a long time ago, you had to be an assistant
True.
and then had to do that
True.
for so many years before you could enter hygiene, right?
So I think that kind of stuck a little bit over the last little bit.
Yeah. Wait. Hold on. To be honest, from a
Yeah.
dentist perspective,
Mm-hmm.
I really respect the whole program.
The value in it.
I value it because I know I can say it freely because both of you guys have a little bit of a dental assistant experience.
I'm not going to roast this too much.
But it does make I call it a hygiene plus. You know how Apple has the iPhone and the iPhone Plus?
Yeah.
It's the hygiene plus. There's a lot of things that you learn, and we're gonna get to that. But I want to talk a little bit about Megan. So give me a little bit of with that first experience. You shifted. You went from, University of Ottawa, and now you're going into a whole dental field. Give me that little brief about the first 6 months.
The first 6 months. I mean, it's all really new. I will say that. I feel like the academic side of it is very exciting because you're learning everything is new, right? Like what type of teeth you have, how many teeth you have, how they come in, all that stuff. But I would say I remember the clinical side of it being incredibly boring. You're like working on a mannequin, you're picking up the same tool 20,000 times and just doing the same thing over again on something that's not even a person. So I feel like you
Wait,
have
how
to,
long do you guys do that on a mannequin?
so long. Like
Okay,
for me,
but-
it was 2 semesters. We didn't touch a
Oh my
single
God.
person.
Okay.
So it's our programs are different.
Very different.
So I would say at Algonquin, if you're going to Algonquin, you have to kind of get through I would say wait until at least semester 3 where you start working on real people to decide whether you like it or you don't. Because there were a lot of people who dropped out in like the first month because they were so bored.
Yeah.
And like it's so different when you're working on a real person versus sitting there on that mannequin. Like, yes, that's going to be boring, you know? So yeah, I think you just have to wait it out. That first 6 months, focus on like the academic side.
Mhm.
Obviously, like you have to show up for your clinics and do the work and put in the time, and that's how you get good at your instrumentation. But don't base your love for the profession off of those first 6 months, because it's going to be nothing like that.
Yeah.
Makes sense.
Yeah.
Wow, 6 months of mannequin scaling.
So the
8 months.
You know
that's
what?
insane.
I see, in dental school, we
Mhm.
go through a full year of shaving wax teeth.
Mm-hmm. Mm-hmm.
And I was so bad at it. This was like my worst, because we sat there for 3 hours, a block of wax, and you have to shave it with the root
Right.
of the shape of a tooth.
Oh.
So you can just imagine the patience of
Mhm.
doing that. And I didn't get it. I used to get really angry. I hated it. I used to just break the wax because I don't have patience. You know me, 0 patience. But you know what it taught us? It taught you the discipline of the career.
Dentistry is like an art, I swear. Like when you watch dentists do their fillings and shape the teeth, and it really is. It's like sculpting.
Yeah.
You know.
It shows you patience.
Mhm.
So I respect Algonquin.
Mm-hmm.
Wait.
Oh.
Sorry. Wrong voice.
Being
Yeah.
new to this.
For doing that.
Yeah.
Yeah.
Did you guys have the same experience?
No. I think
Right away patience?
so. Basically, our
You're a COVID.
course,
You're a COVID hygienist.
I'm a COVID. So our whole course is just split up into 3 terms. That's it. So basically, term 1, you go in, you're learning literally teeth, all these basic things for you to start the program. So term 1 can also seem extremely overwhelming, extremely like I lost my words.
That's okay.
You got this.
Okay, I got this.
COVID hygienist.
Wow.
Shout out to COVID hygienist.
So intimidating. It can feel very intimidating at the start, and especially when you don't have that dental background, you can feel like just I want to drop out. Like I don't want to do this.
Mm-hmm.
But the same thing, like as it starts to go on, once we hit term 2, we start seeing like patients in term 2.
Okay.
So term 1, it's like you're going. We call it pre-clinic. You're working on the typodont. You're scaling, but like for one instrument, we have like a week.
Yeah.
And
it's
you're getting
very
tested on
slow.
it.
Very
And then we do like 2 instruments, and it's like test, and it's like, all right, we're starting patients now.
Wow.
Yeah.
That's fast.
Yeah.
Yeah. Which do you think because of COVID hygiene they made it shorter, or was it same?
I don't
Because
know.
but you still did a year and a half, every year and 8 months, right?
We did actually a year and 5 months.
Okay.
So they really
Yeah.
it was cram time. But I know now they did extend it. They have added a couple more courses as well, I think, to make it a little bit longer for you to kind of process the information more. Now I'm pretty sure it's like 22 months right now,
Okay.
which is honestly, I agree with that. I feel like a year and 6 months with especially something that's so serious, it is a lot at that time.
So
Yeah.
compared to 6 months of your program, just scaling on, and then walk me through the last 6 months.
So the last 6 months, honestly, that last semester, the way that Algonquin kind of positions it, So you have 6 semesters. So it's essentially a 3-year program, and they've taken out 2 of your breaks. So you do 3 semesters, you get 1 break term, 4 months off, and then you do another 3 semesters. So in the first 2, they're setting you up, teaching you all the like basic skills, and then you start to see your patients. And then in the last 6 months, it's really heavy clinical, or I would say the last semester, so last 4 months more so. It's really heavy clinical, so you have a lot of clinics, and you're very
on actual patients.
On actual patients, yeah. And you're very independent at that point. They are expecting a lot from you. Like, they want you to see so many patients and go through like start to finish, completing them. And then on the academic side, it's more so that semester is getting you ready for that exam. So that last 4 months, they know that you're going to be taking that test. So a lot of it is all of your classes are pretty light, except for the class that's about is preparation for your dental hygiene exam. That's the whole purpose of that test or that class, which you pay a lot for that test, and some people pay a lot for courses to prepare for that test. So I think
you're talking about the board exam.
The board exam, yeah, before you can start practicing.
Monster of the journey.
The scariest thing.
It's like, yeah, exactly.
I think we kind of had the same similar thing of towards like the end, like our last term 3 was just mostly like assignments, this paper, that. So, and then we had a national board exam course where we were just breaking down the whole year and a half of everything that we learned. And then, like Megan said, you're purchasing these courses, and then student RDH, that's like a big one. Did you have that?
We were actually advised by our professors not to get it. They said that they didn't think it was worth it, that if we went over the material from our board exam course, that's all we needed. And I remember when I studied for my board exam, all I looked at were the Quizlets that me and my friends had made in our last semester. That was it. That's all I used. And I was in and out of there in like an hour, maybe less, 45 minutes.
The board exam?
Yeah.
Wow. Okay, so
Algonquin's gonna get another shout out.
I definitely had a way different like experience in that, because we like the biggest thing was I feel like I wouldn't even have passed without that like student RDH, like that extra course. But I feel like it can also kind of depend on like you as a person, like how you study. I'm like, I know personally myself, I cannot take a year and a half of like stacks and stacks of notes and be able to break it down in a way for me to know everything that I need to know for the board exam. I'm like, I need something that's condensed, but it's every important thing. There's things to remember, these things, and yeah, it was total game changer.
All right. Now I want to take me guys to the point where you're preparing for that board exam. So let's say you guys kind of shared both experience. Now I want to know, you just got your result, right? That good feeling of, okay, I'm a certified RDH. And I want to know that process and getting a job. But before I jump into that, I want to rewind a little bit because we forgot about a very important point.
Wow.
The experience in the dental field while you're doing hygiene.
Smart.
I want to just tap into that because that is, for me, is that hygiene plus.
All right.
So tell me a little bit. Yeah, talk about that point.
So being a hygiene plus, basically, if I have one piece of advice for anybody that is going into hygiene school, is try your best to work in a dental office, whether it's like you're working a couple hours that you're not in clinic, or you have 4 months in between the semesters, something to, whether you're a receptionist, you're a floater, just getting that real life exposure, because school and hygiene school are not the same at all. I started working at, shout out Mersal Dental.
Give me a minute.
While I was in hygiene school, I literally started as a floater, just did steri. I went in and I was like, listen, I'm going to be a hygienist in so many months. I want to start working in an
And
office.
then my eyes got dollar signs.
So, yeah, and like just basically what they don't teach you in school is what you learn, and what is so important showing up your first day as a hygienist. You don't want to worry about how do I open the system? What is the system? How do I write a note? How do I like communicate properly with my patients? Do I bring them in? Do I sit them down? What do I go like? Because in school, it's like there's being so much thrown at you, and every appointment is very long in time that we have an hour with a patient. You know what I mean?
True.
So just having like that just made me coming in as my first day as a hygienist so much more comfortable that literally it's just like a switch of chair for me.
Yeah.
Like I did everything
So you
else.
did that while you were studying hygiene.
Yeah, so I would have like a 3-hour gap, and the previous owner of Mersal Dental, they were just looking for a part-time floater. So I'm like, this is perfect. I'm just going to work the 3 hours here, 3 hours here, 3 hours there. And then at that time, I was doing steri. I was shadowing the hygienist. She was explaining things to me and that I would have never known. She's like showing me little tricks and tips, and we're doing notes, we're doing perio charting, and then coming into it as a first day as a hygienist, you don't feel like, oh my god, I need to do my note, oh my god, I need to do a perio charting, oh my god, this, that. It can seem overwhelming. But when you do have that experience, all of that just kind of like goes at ease, and you're just comfortable.
Yeah.
Like I'm just switching chairs right now.
True.
Yeah.
Well, what's your feedback? I want, so you, Sarah, you did that during your hygiene school, right?
During hygiene school.
Megan, what was your experience in assisting before going into hygiene? Like, how did that switch happen?
So I applied to hygiene school. I did my first 3 months, and then during my break term, right in the middle, I had like just started seeing some patients in semester 3, and then we go on break. So you have this long gap where you've seen maybe like 1 or 2 people during that time frame, and then you're going to be off for 4 months, which feels like such a stall in your like evolution progression as a professional in the dental field. So I knew, I was like, I think that I should get my foot in the door somewhere just to practice even the soft skills of dentistry. So like talking to patients, like you were saying, feeling comfortable, even just being close to another human being in that proximity.
Did you see a patient in Algonquin? Did you see patients before doing that, or that was
like maybe 2?
you're still scaling
I think
on
2.
the
So
2
we
patients
start,
fresh.
yeah, it's still super fresh. And it's like you've seen one patient like the entire semester, because you have to see them for like 5 appointments, because everything you do, your clinician has to come in, check it for you. So it takes a very long time. Like the patients that come in when you're in hygiene school are incredibly patient and kind to do what they're doing.
Now that you know how the real world works.
Yes, it takes so long.
Yeah.
God bless them. But
Yeah.
what was I saying?
To the point.
Yeah, to the point.
Once, yeah, so you finished, when did you start assisting?
Right, so during my break term, I was like, let me get my foot in the door. So I started at a pretty big office, actually. They were looking for an assistant for one of their newer dentists. So I didn't know any of this. I called and I was like, oh, I'm looking for an assisting job. I'm just a student. I have no background at all. And the manager there at the time was like, that's totally fine. Like, we'll bring you on. We'll like show you the ropes, whatever. And again, God bless that dentist.
Did they know you're in hygiene school?
They did.
Okay.
Yeah. So I told them I'm a
so
hygiene
dollar
student.
signs
Yes,
came into
exactly.
that.
I think that was part of it. It's like you have to know, like, as silly as it sounds, you have to know your worth as a hygiene student, because you have if they invest that time in you, you can become like a great employee for them one day. So there is benefit to them. Like, even if you come in not knowing anything or just knowing like the very little basics, there is something that you're bringing to the table if that like relationship is mutually beneficial and you stay on with them, right?
True.
So
I agree. I feel like that kind of
you have to be confident coming in.
Yeah.
That like there's something that like it's not like they're necessarily doing you a favor, because eventually, like, they are, but eventually it will pay off for them. You know.
Yeah.
It is an investment.
It's a two-way investment.
Exactly. Yeah. 100%.
So okay, so you worked during your hygiene school as well.
Yeah.
It was the same period of time. How long did you assist for?
So I assisted full time for that 4 months I was off. And yeah, the dentist that I worked with was super patient. He taught me everything I know because I knew nothing about assisting. That's like one thing about hygiene. Like you really don't learn very much about the assisting portion of it. And that's the benefit of working as an assistant during school. Because
was he a new graduate?
He was a new graduate, so
oh
he was
my God,
very.
They normally don't have patience.
It was a busy office, so he had a pretty like I think he'd been there already about a year.
Okay.
But he had like kind of like temp hygienist, and I think he thought. I remember my first day, I came in and I was like, oh hi, doctor, whatever, I won't say, but I'll be assisting you today. And he kind of laughed and he was like, okay.
He's like, oh,
literally,
man, they gave me the new girl.
Yeah.
They hate me that much.
Yeah. And I think it took like a good month for me to get the swing of things, but I learned so much. And then it was like, there is almost like a secret language between dentist and assistant when you work with someone specifically and you learn the way that they like to do things, because every dentist is so different. I think that I learned way more about dentistry specifically doing those 4 months of assisting than my entire time in school.
100%.
Go back now, Sarah. Tell us about your experience, because I know. Just I know that you got promoted suddenly.
Okay, so let's go back. So once again, I started working here while I was.
I'm just gonna hide my eyes on this.
I was working here while I was like in school. So I was just doing floating. I was floater staring. I'm like, this is good, like I'm learning, whatever. 6 months go by. One day I get a call from my old office manager, and she's like, there's something we need to talk to you about, like you have to come in. And of course, I'm getting fired.
They're cutting me off.
So then I go in, and then long story short, he's like, I'm selling the office. And then next thing I know,
there's a new boss in town.
There's a new boss in town. And I was like, oh, who's the new boss? It was like a movie, I swear. Sliding door opens and she's like, I'm your new boss now. And I was like, oh my God, I'm out. I was like, I'm out.
He's going to fire me.
Yeah. I was like, why would he, like, you brought staff with you. Like, it was
I brought
busy.
The whole team.
You brought the whole team. Like, why does he need me? I don't know anything. But like you said, I was going to be a damn hygienist.
That was a good card.
But
dollar signs came out.
But no, I feel like we started like working together, and at that time the old assistant ended up leaving, and then I was promoted. He was like, okay, Sarah, so we gotta do an extraction. And I'm like, who are you looking at? No, it's not me. Oh my God. He's like, get in the chair. So that was literally like that's how I was at Stary, and he comes to me and he's like, you're promoted. Like, go get in the chair.
My first day, my first patient was also an extraction.
I feel I was really excited though. I was like so excited to finally like be in the room, and like going back to like what Megan said is you learn so much, and I honestly feel like me as a hygienist, you as a dentist, I feel like we work very well together. Hygienist plus. And like I feel like we work together very well because I assisted you for what, like 10 months?
Yeah, I was stuck with her for 10 months.
Okay.
All right.
So, but yeah, I feel like now, like, just having, like, we've worked together as, like, assistant and dentist. So now as a hygienist, it's like, when I'm doing my thing, I know, like, okay, he's going to need this, this, and this. He wants these questions asked and this and this. So when he does come in the room, we're not wasting 10 minutes of, like, okay, you need to do this and this and this. When you can come into the room and x-rays taken, scan is done, here's your cold test, your bite stick. It's like, let's go.
Yeah.
So it makes the office flow, I feel like, very well.
Oh, 100%.
Yeah.
For me, it's always about the dental, the Hygienist Plus. That was one of the things that when I remember with Megan when we were doing the interview.
We were like, she's a Hygiene Plus.
She said, I did some years of, and I was like, okay, done. Yeah, okay. I don't care about whatever you say, right?
I was so nervous for that interview.
The rest doesn't matter for me. She's a Hygienist Plus. Yeah, you're getting the job. Now let me act like I don't, I got options.
Yeah, no, literally. I remember during my interview, he's like, yeah, I have another person coming in tomorrow. I was like, do you really?
Yeah, Hygienist Plus. I made up my mind. Let's go. Okay, so I want to tap into another interesting topic. So walk me through. You graduated, you got your certificate. Now you did your interview process on finding a job. I just finished. I'm on RDH. I'm excited. I want to apply for work. How did that process go?
Um,
Do you want to go first?
yeah,
Yeah.
you can go first.
No, you go first.
Okay. So I feel like once it was a little bit of a different experience because I was already working with Joey as an assistant, and once I became a hygiene, we had an open room, and he basically was like,
Let's go.
"Let's go! Like
Yeah.
this is like let's go. This is your room now."
Yeah.
So it kind of like I didn't like my experience was probably a little bit different than what yours was.
It's actually really similar.
Really?
So when I was working as the office where I worked
I was
as
just
an
saying,
assistant-
guys, dollar signs came up. They're gonna keep you guys.
Yeah. No, when I was working as an assistant, after when I went back to school, I couldn't obviously continue to assist. The hours just didn't line up. So I was working reception, floating. Like I would come in and I'd come in and like unbox stuff in the back, like do putting away the orders, that sort of
Cleaning
thing.
shelves, like Sarah.
Anything. Like yeah, essentially. Like at that
Falling
point,
down.
keeping me on was a favor that they were banking for that investment of me
Yeah.
doing hygiene eventually.
Yeah, buying a stock on a low price.
Exactly, yeah. So I would come in and sometimes I would even sit in on some of the hygiene appointments like that also as a student grad, like getting that experience, sitting in with an experienced, seasoned hygienist, it's like invaluable. Like
Just like that
next
exposure.
level. Yeah.
Like-
and you really have to like absorb their advice because it's so different from school.
100%.
Definitely owe a lot to those
Yeah.
experienced hygienists that gave me advice
I-
in those early times. But
Right.
yeah, I was basically just bridged in. Like they had patients booked and I hadn't gotten my test back that they were canceling and rescheduling to the following week until the day I got it. The next day I started at 8 a.m.
Wow.
I got my pass. I was registered. The next day I was working.
Full schedule.
Full schedule.
Wow.
Oh wow.
Yeah,
That's
it was
good.
intense. But I was taking over for someone who had just retired.
Okay.
So
A
she,
hygienist.
yeah, the longest standing hygienist, the most loved hygienist at this office. Like she'd been there for like 30 years and she moved on to another office and
Yeah.
she had like
So
an
they had a
incre-
patient base ready for you.
They had a
Yeah.
patient base and they had a loyal patient base. These patients did not want to see me. They were like they wanted their OG hygienist. So it
Oh,
was
that
a
is true.
challenge for
yeah.
sure.
Yeah, we're gonna tap into that topic for sure.
Yeah.
And for you, Sarah, I know you did because at the time we didn't have you full board. We were working on
Yeah.
expanding our hygiene program, so
Mhm.
you were still working otherwise a couple of days, right?
Yeah. So basically, when I first started, I think I had 1 or 2 days at the office. Like
Yeah, it
one
was
day,
like
some
2 days.
2 days and a
Yeah.
bit. So obviously, starting out, I just graduated. I am living on my own. I have bills to pay. I'm like, I just can't work 2 days a week. So I was like, I need to go find somewhere else. But I'm like, let me just try start temping. Let's just get our toes, whatever. So I applied for this temping job, and then I went there. Basically, after my first day, they were like, "Do you know what? If you have these and these days off, you can just work here for these days. So you're not like signing a contract. You're not like working really like with them. It's just
So
you
like
have
a
the
casual
exactly.
contract.
It's like a casual thing. You're just I'm a temp. Like,
Covering days.
exactly. So, and it also gives you flexibility if you do want to do things. You're like, you know what? Maybe I don't want to work this day, or this is convenient. I don't need to go to 4 offices this week. This one office will have a set schedule for me, and I can work here until, I do find a permanent job that I want to stay at, right?
Yeah.
But for me, I always knew, like, I worked with you guys, like, since day one, and I'm like, our goal was to expand hygiene, so I did my thing, and I didn't mind it. I feel like that time did teach me a lot, too, because, like, it's also good to know other ways other than just, say, our way, how we do it at our office.
Yeah.
So you learn so many things, you're exposed to so many different things, and, like, it just opens your mind to a lot.
Yeah, true.
Yeah.
Now, I'm just gonna tap into something now. I'm just gonna talk a little bit about from a dental perspective. Like, for me, I went through the wave of hygienist before COVID
Mm-hmm.
and hygiene after COVID.
Mm-hmm.
So before COVID, I'm talking 2018, there was quite the saturation going on. There, it was a saturated field, I would say.
Mm-hmm.
Um, and like Megan was saying, that retired hygienist that she took over her list, those retired hygienists used to work in the field for a number of years. I used to go into offices where there's no way I'm gonna find a hygienist that is younger than 50 years old.
Mm-hmm.
Really?
Yeah.
That's so interesting.
And because they were working for such a long time, the patient base, as Megan was saying, is so loyal to that hygiene that she decides what happens with her patient list. And they had kind of like a, you know, if
Like a
we like,
monopoly.
yeah, if we
Yeah.
like you, oh yeah, that dentist is hands, he's so smooth. That's one from my patient, you know? So I find it was so unfair for young, because at that time I was like maybe 5, 6 years into dentistry. So I felt it like so biased. So I was waiting for those, hygienists to like, okay, you don't really need to talk about me like that.
Mm-hmm.
And then COVID happened, where a lot of, the OG hygienists, I'm gonna call them, retired.
The hygiene
And-
plus.
Yeah, those are the hygiene plus. When they retired, they opened the door for the young generation to finally work. Because I was telling you guys before the podcast, one of the hygienists that I was working with was actually working reception, sterilization on a different day, and then doing hygiene for a day and a half.
That's so crazy.
And she was so happy.
Yeah.
Yeah.
Like,
yeah.
I was like, I got you a day and a half.
Yeah. Like, we jumped in at a really good time.
True.
And because like we never saw what it was like during that time, and we jumped in, and from the beginning it's like hygiene are making this much an hour, hygiene is this, we need hygiene, everyone going to hygiene.
True.
So it didn't feel like that.
I think there's been a lot of advocacy also in the last few years about just like how important dental hygiene is.
Yeah.
And the links to, like, your teeth are a part of your body, and it's connected to everything that's going on. The bacteria that's in your mouth is the bacteria that's in your blood, that's in your brain, that's in your heart.
Mm-hmm.
And it can affect your overall system. And I feel like that's much more widely known now. So I think, I wasn't around for this, but I've been told that hygiene used to be almost like an elective procedure, whereas now, like, you get your teeth cleaned every 6 months if you have the means to do so.
Mm-hmm.
And it's kind of crazy to most people, like someone who just opts out of the dentist and is like, oh, I'm not getting my teeth cleaned, it's like considered unhygienic at this point,
True.
Yeah.
So I think that there was a shift in that, and like the cultural view of it as well.
Yeah.
I totally agree.
Me too.
It was so on average to find one dentist, one hygiene per office, versus after 2018, the average is 2 hygiene, 1 dentist. And we used to find it very challenging to book hygiene appointments after finishing dental work. So they were more interested in getting the dentist's perspective than to see the hygiene for the cleaning.
That's
Versus 2020, that perspective changed.
Mhm.
I feel like nowadays dentists rely more on a good communication between hygiene and patient than dentist to patient.
Which I feel like plays into, like, I can speak to, I've only had good experiences with dentists that I've worked with, but I feel like working for someone who has a respect for you as a dental hygienist and like what you can bring to the table and what you're bringing to their practice in terms of communicating and supporting them in delivering information to their patients about what they need done, because like there is a relationship between, they come back to see their dental hygienist twice a year, right?
Mhm.
So you build that relationship with them, and then they begin to trust you. So I feel like working with a dentist who considers that valuable is really important, because not that I've heard stories where like the hygienist is not treated well, or like not seen as like, not necessarily, because obviously in most cases the dentist is like the owner of the practice, but they see you as like part of the team and not someone just like working for them, you know. Like I think that difference makes such a difference in the way that your hygienist will show up for you as well in the practice.
Yeah.
True. I see it now. You're right about the whole team perspective. Does my personal experience, the smarter the hygienist that can catch up on things, the better I can ease up. Because I always put in front of me, if I have a good hygienist in that room, that's gonna let me know, because I'm coming midway from an implant placement where I drilled bone and I'm thinking about 1.2 diameter and keeping my implant safe. And you're like, Dr. Mersal, I need a recall. I come out of that room, I am functioning 15%. And I'm talking to all the dentists out there. I'm functioning 15% because I'm thinking about the assistants putting the suction around the implant. Is the bone okay? And I'm going in, and you're telling me about, Mr. Smith, his crown is loose, and I need the findings. Give me, because my brain is working on 10%. And that makes the dentist really appreciate the hygienist that he's working with. Moving into a different topic just to de-escalate. I feel like the room is heating up. Work-life balance. That's going to be a fun topic. How do you balance between, hygiene is very demanding, a lot of hours, a lot of scaling back, arched up, and tell me how you guys, differentiate between both.
So I feel like this is kind of a good topic because Megan and I kind of balance things a little bit differently.
Yeah. We definitely have different approaches.
Yeah.
But some of the same.
Same,
too.
for sure.
Yeah.
So I think the biggest thing is me right now, like I work 6 days a week. And Megan works 4 days a week.
I gotta give a shout out to 6 days a week.
For real. I'll work 3.5 to 4, depending on the week. But we do 1 3.5, 1 4.
Yeah.
And one of those days is a 12-hour shift.
So that's
I'd like to get
a day and a half.
Okay,
it's basically 4
days.
4.5.
Yeah, 4.5.
But still.
Sure. So you and I, we work 6 days a week. I feel like for me, it's very much just making the time for things that are very important, because if you fall off track in your personal life, that can kind of just affect you and feel like you're just getting so drowned at work, and it's just all you do is work, right? So I feel like spending time on your hobbies, I like going to the gym. We recently picked up a new habit of Pilates. We actually do that together.
Shout out to Pilates.
Shout out to Pilates. Yeah.
I tried that thing once.
Almost died.
We're gonna talk about it. That's a whole
Definitely
different
wasn't
headline.
for Joey.
Yeah.
Yeah.
So we really enjoy that, and it's a way you're stuck like this all day, right? The biggest thing about being a dental hygienist is one, the physical ergonomics. You have to think about it. We're sitting 8 to 12 hours a day, and you're just, whether you have loops or not, you're still slouching and you're just constantly moving your arms. So that kind of ties into taking care of your body in a sense of making sure that you are prioritizing massages or chiropractor or anything like that. And I didn't realize the importance of that when I first became a hygienist. I went 2 years before I did anything, and I used to be how am I gonna do this? I'm only my second year in. So spending time towards that, and then also, making sure you are prioritizing your family, your friends, and balancing, rewarding yourself from time to time with a vacation or anything like that, just to, give that sense of balance where you're not just so focused on work.
Yeah.
Especially when you are working a heavy load like myself, 6 days, you gotta make sure you're still doing it.
Yeah. Now I wanna tap into something a little more interesting. Pulling yourself away? Now, I know the dental field is very stressful. I talk from a personal experience. You guys deal with a lot of angry patients, patients that are, you got to give feedback about their gums, their oral health, making, following up with whatever the dentist throw in the plate, because sometimes the dentist is like, yeah, the patient needs to be sent out for a biopsy, and he's out of the room. So tell me, tell me, how do you separate that from your personal hobby life?
I think that some of it starts in the office when that sort of thing is going on. Like, I try to remind myself that, like, the distrust and the anger that you get from the patients is rooted in most of the time fear, or just like fear of the unknown is a big one, but also it's very vulnerable. Like, your patient is in an incredibly vulnerable position. You have sharp tools in their mouth, and they're expected to just sit there and like not move, don't say anything, like, so you have to have a lot of empathy for your patient. Sometimes I'll like try to think of my patient as like, the child that they once were. Like, this is like someone's baby. This is someone's, like, they're super vulnerable in that moment. You are the one taking care of them. So when I think of it and like position myself as like you're taking care of them in that moment, it makes it a little bit easier. And if someone is being, you just can't take it personally.
Yeah.
But I do think that like having time to yourself and like a almost like a routine of like unwinding at the end of the day can help to let all of that go.
So what do you do for unwinding?
I definitely need like some quiet time when I get home.
Yeah.
It's a lot of socializing. It's like 8 hours. That's one thing about hygiene that I personally didn't know. It is so social. Like, you are spending 8 hours one-on-one with a different person
They
every hour.
don't tell you.
No.
They don't. This is not in the description of becoming a dental hygienist.
Hear it here first.
Yeah, hear it here first, folks.
You are like this person's best friend for an hour. You're gonna hear about their dog. You're gonna hear about their kids.
And you know what? Majority of the time, it's like, I feel like it is the kind of the way that you like look at it. Like, at the end of the day, like, most of the patients that come in are actually really funny, or there's something interesting, or they're a lawyer, they're a doctor, they just had their first kid, they did this, and like, I find that part actually really special. Like, I enjoy that part. And then you have, all ages coming in, people are talking about certain things, and like, we're always chuckling at our patients.
Yeah.
Like, that part is fun.
Chuckling with our patients, with love.
Yes, of course. But that kind of goes back to the whole part of, it is very like mentally draining. And I know I'm the same way. Like, when I go home for 1 hour, I'm like, I don't want a phone call.
No.
I don't want people to I'm not answering text messages. I don't want to talk. I'm just gonna like
Vegetable time.
Yeah. Whether it's like I spend that hour, I cook, I meal prep, I do my thing, but I'm like in my zone, and I'm just like quiet time. So I feel like that is a huge part for sure.
And then however like you decompress, I think that with hygiene, like we were speaking to before, the ergonomics of it all, like you're hunched over all day, I think that if you can channel that need for a release and like a calm down into something fitness, like whether it be like Pilates or hot yoga or something, just to like open up your shoulders after being slouched all day, that's great and will benefit you long term. But not everyone gets like that nice feeling from working out. I know that's not for everyone, but if it can be your way of decompressing at the end of the day, that's a great option.
I find it was one of the best things to do after a stressful day is to go for a 1 hour gym. It just clears your mind.
Gym, walk, Pilates. Yoga, literally any sort of just like, because you can be a little bit mindless when you're doing exercise. Where it's like you're focused on just like your health, improving yourself, and you're forgetting about everything else. It's like a moment that is truly for you.
Shout out to mindless. So part of the job, if you want to be a hygienist, you have to have that mindless hour after you're done work.
100%.
Okay, I wanna ask a question to finish this chapter up. Tell me your number one biggest challenge as a hygienist in the clinical. The number one challenge. It could be the customer service. Sometimes I'm just not in the mood. It could be because Dr. Mersal doesn't give us sharp instruments. I don't know. Let's name one. You would say the number one challenge. It could be X-rays.
I feel like I have two.
Okay.
Okay, you can go first.
Okay.
Let's hear it.
Hit me with the two.
Okay. I'm not like a super I can be friendly. I'm not like a closed off person, but I'm not a super socially outgoing person. So one of the things that I had to learn to be good at was small talk. Like I don't come to small talk naturally. Like even, I don't know, I feel like you guys can kind of, like when we have one-on-one moments alone together, like I'm talking about the deep stuff, like how's your life going? You know, like I'm not asking people about the weather on a daily basis. So that was something that I did have to learn, was how to make light conversation and pleasant conversation without breaching like super deep topics and maybe crossing into uncomfortable territory, because you do want to keep a level of professionalism with your patients.
100%.
Yeah.
And then I feel like for me, I can be like a little bit of a perfectionist, so I have a lot of self-doubt with our profession, and I feel like I hide it pretty well, but I do get...
That was number two?
Yeah.
Okay.
Number two is definitely like self-doubt and just like wanting to provide my patient with the best care, but feeling like maybe I'm always forgetting something, or maybe I could be better, like, because at the end of the day, it is healthcare. Like it's in Canada, people pay for dental care. It's not 100% covered.
True.
For most people anyway.
Until CDCP came in.
Until, yeah.
Shout out to
CDCP. But yeah, I do feel like I just always feel like a little bit of self-doubt, a little bit, but I think that's good because it challenges me to be the best that I can be. And that's like one of the things that I in turn love about dental hygiene, is like something that people hate about is that it's repetitive. It's the same thing over and over and over again, but I personally love that. I always tell my patients, like, I'm only getting better at it every day.
100%.
You know?
Yeah.
So it's like, yes, you're doing the same thing every day, but if you're kind of letting that be like, oh, well, it's the same thing, I'm bored, I'm done, you're not growing at all in your profession. When there's always a new clinical study, there's always a new method coming out that you could be implementing to benefit your patient. So
that is so
Yeah.
true. I find that very close. It's our field in general in dentistry. The day that you stop learning and to stop doubting yourself in your work, you're not improving. I've been doing dental crowns for over 15 years, and every time I leave a crown, I look at it and how can I make the other crown better?
yeah.
And if you don't have that and that switch is off, you're not upgrading in life.
Yeah.
So that's something that there's no issues with it, and it's something that you always have to have it activated,
Yeah.
Yeah. So what about you, Sarah? What would you say your first biggest challenge about hygiene? Name you're allowed to name one or two, because Megan named two.
The first challenge is
Sarah's just killing it.
No challenges.
No, I'm just trying to think.
I think your challenge is over talking with the patient.
Pardon?
Sometimes I'm like,
Okay,
Sarah, I
let's
need to
be
do a
fair.
recall. Stop
Let's-
talking to the patient.
Okay,
I'm the
let
opposite,
me once again shout out Newfies.
Mhm.
One thing about being from Newfoundland is we are very talkative, friendly people. So, and I'm not introverted whatsoever. I love to socialize, I love to talk with people. So I feel like that really did help me, like, with this job. But there is that part that I do struggle with of, getting patients, like difficult patients, or coming to terms with that, like, not everyone is going to like you.
I think we're met with a lot of apprehension and a lot
Yeah.
of distress. Like a lot of people think that dentistry is like slimy, or they're trying to pull one over on you, get
Yeah.
your money, because it like all in Canada we're super fortunate. Our healthcare is covered, right? 100%. We don't
Yeah.
ever have to think about it. It's just there. It's something that you are entitled to in Canada.
But
But dental
care.
is not that.
So, yeah, I think this kind of goes into the same thing of, now once the dentist comes in, it's all glory, they're all
Mhm.
nice to you, but we're the ones, like, we have
Take
to
the brunt
we take like the blunt, raw conversation. Like these patients are coming in and they're like, well, why do you want to do this and this? And I don't like the way you're doing that. And oh, you poked my gums here and this and that. So I feel like that was kind of challenging for me at the beginning because I'm like, I was like, well, why are these people saying this about me? Like I've always been like a very friendly, I'm a kind person, but like like how do I navigate this and like not almost like let it affect me and like let this person like make me feel like that's how I am as a hygienist.
Yeah. So you're
So
saying patient's criticism
a
about the
hundred
field.
percent, because they can make you feel, especially when you're young. The first thing they're like, oh, you're only 6 months into being a hygienist. Like, what do you know? And they try to intimidate you. And I feel like that's kind of throughout any professions. Like, you're gonna come across people that are gonna look down to you, people that are gonna try to put you in that vulnerable situation. But at the end of the day, like, just knowing that you're here because you put the work in, like you're very much
And
capable.
and you guys can do like basically hygiene. I can never compare my work as a dentist to doing scaling as a hygienist. There's no way.
Yeah, I
I
mean,
can't do the work that you guys do when it comes to scaling and root planing. There's no way.
mhm. It's
I feel like with dentistry, people come to you when they're in pain
yeah,
and then they leave you without pain. So there's a very clear, like, okay, this is working. Like it's a means to an end. Like I've gotten the filling, my cavity is gone, and now I'm good. Whereas with us, it's so preventative, and it's almost like this like theory that some of them just don't believe in. They haven't been either. They haven't gotten the education. So a lot of people just don't know. Um,
Yeah.
or they're apprehensive about it, which is fair. And I think that like in Canada right now, there's a shortage of even medical doctors, so patients have
Yes.
had to do a lot of self advocacy. So I respect that. I think that you should do your own research, know what's good for you, and make your own decisions about your health and your body. So I can totally understand the patient's apprehension. It's one thing to question it, and it's another when someone is meeting you with like just like this deep hatred for dentistry. It's very hard to combat it as like someone like, let's say I just met you but you've had bad experiences in the past. That's hard to come to terms with as like someone who's just trying to help
Yeah.
your patient, so
'cause
I definitely understand that.
yeah.
Makes sense. Another nice, interesting topic. I wanna get into, you guys both have different experiences, so putting it in this episode is very important. Is corporate versus personal ownership.
Did you work corporate?
I did not.
Okay.
Now my best friend,
Oh,
she
okay.
did.
So
So
indirect.
indirect, but me personally, no.
Okay.
Yeah. So we're gonna keep it briefing without mentioning names or anything, but
Yeah.
it's just from a hygiene perspective, and I totally respect both ways. I personally worked corporate, and at the moment I own my own dental practice, so I'm gonna be a little bit 60-40 towards. But at the same time, I want to know from a general perspective. What's your thoughts now, Megan? I know you did a little bit of corporate work.
Yes.
Sarah, you did more. Even in the other offices you worked with, you did more private owned,
Yeah. So
right?
everything that I did work in about 3 other offices, and they were all private owned. So I didn't get
By
that
private owned, we mean
like
the owner of the office is
office.
working with you at the same time.
Exactly, yeah. And it's always just that one dentist. So
Interesting.
you kind of get to know that dentist. It's like it doesn't feel like you're just like kind of floating all over the place and it's like, oh, here's another dentist, here's one dentist. I'm like, okay, well, this dentist, I don't know how this guy works, whatever. So it's like you get very used to that dentist that you're working with, and they do care. From my experience, everyone that I've worked with, they do like care about like you. Like you're not just walking in every day and like no one's even saying hi. Like it's always like, good morning, how was your weekend, what did you do on your holiday, like the hygiene we're chat, you know what I mean? So it's like
Yeah.
it's like more of like a closer bond, for
Makes
sure.
sense. Megan, you had
Corporate.
Yeah.
more experience in the corporate world.
Yes.
Yeah. So tell us a little bit about that.
Okay. So I started off in a corporate office. It was a really big office as well. So the office that I used to work in had, I think, a total of if I remember, it's 6 dentists, five or six dentists
Working at the same time?
at the same time. Yeah, and
Wow,
so
how many ops?
Wow.
I think like 15. It was a giant office. And I will say, so I personally think, and like I've had friends ask me, how did you feel about corporate hygiene? And I think that the bottom line is, do the dentists that work there still have a stake in the company? So where I worked, the offices or the dentists were all still partners. So they all had a stake in the business that they had created and then eventually decided to sell to Dental Corp. So it still felt like that camaraderie, that patient care first, but I know that there was a lot of back and forth that happened between the dentist, between the office manager with Dental Corp to make sure that things stayed that way. So I think that obviously it's going to be office to office, and I had a really good experience at my office in terms of the relationship that I had with the dentist, even with my office manager. She was like a great boss in so many ways, and she really advocated for us to get us like raises and even like opportunities and that sort of thing.
Mm-hmm.
But that isn't always the case with corporate, and I know that that's not always the case with corporate. I was really honestly fortunate that
You had
I
a
started.
hybrid.
I did, yeah. It literally
I would
was.
call it the
It's
hybrid.
like half and
mix.
half, really,
Yeah.
because
The owners are still can
Mhm.
step in and make decisions for the staff that they're around.
and like they could make decisions, and they did. Like they would put their foot down with certain things, and they would go to bat for us. But there was a lot of like them being like, no, like this is how it is, and we're not swaying on this.
Mm-hmm.
I remember like very vaguely being let in on some of the behind the scenes sort of situations where it was like very clear that they were fighting for us, where maybe Dental Corp, you know, the higher ups, they're not there every day. They're not seeing you how hard you work. They're not seeing the patients. They can keep everything at a little bit of an arm's length.
Mm.
So they might not be able to relate to the workers the way that your boss, who's there every day, like the dentist that you're working with, your manager, who's like seeing you put in these hours, seeing the even like the production that you're making, you know, and like what you're putting into the business, the hours that you're working. So I think that you're always going to get maybe a more personal relationship with a privately owned business.
Mhm.
Mm-hmm.
But it does still depend. I think like really you have to like shop around when you are starting hygiene, and don't settle for, like, if you aren't happy, you know, go on a few interviews and see what else is out there, because there are great offices. And there are some, like, I haven't personally experienced them, but I have friends who have been at offices where they were very unhappy, and they thought that that was normal, and then they kind of started talking to people and going on interviews, and they realized like, oh wait, I should get, you know, like at least a full hour for a new patient hygiene. And it's like, well, yeah, you need some time to clean their teeth. What are you supposed to do, you know?
Yeah.
True.
So
True.
Mhm.
Yeah,
Yeah.
that's very important.
the balance between like patient care and obviously like dentistry is a business, but there has to be a good balance of both.
That is a hard balance.
It is, yeah.
Because for me, it's different from a new owner that just purchased a new office and taken on a big amount of debt.
Mhm.
Because when you first get exposed to ownership, now I was lucky enough I started it before I moved to Canada, so I kind of had an experience on where I need to be. But from a dental perspective, when you purchase a new office, they give you the loan on the production of the dentist before you.
Okay.
So what that means is you are expected to keep all the patients in his roster happy, to produce the same number at the end of the year, close or similar to what the old dentist used to produce.
Interesting.
Now you come in, 35% of your patients are gone.
Yeah.
So the dentist puts himself in a position where he needs to be very picky on how he spends his money, because honestly, I had months where I was losing $12,000 a month for 4 to 6 months before I made $1 in profit.
Really? And that was from lost patients?
That's from lost patients, because I gave the bank what the old owner used to pay for,
Mhm.
make, and then now I'm expected to make the same production, if not more, than the previous, knowing that at least 30% of his patients
Right.
are going to be leaving because.
So there's some like, I feel like ethics comes at play, right? Because it's like, okay, you need to make a certain amount of money. So what are you willing to do to meet that? So you have to be like an ethical person and say, I'm not going to cross those boundaries.
Yes.
Mm-hmm.
And I feel like that is sort of maybe where some of that distrust comes from with patients of like, because we hear often from patients like, oh, I went to this dentist and he said I needed 10 fillings, and we're looking at them and we're like,
you have
what
zero cavities.
Yeah, where are the cavities?
Yeah.
You know, so.
True, that's a hard challenge.
It is.
Yeah.
So for me, when that happened, it puts you you lose 35% of your patient list.
Mm-hmm.
Now your hygiene needs to be strong. No, I'm losing my hygiene. So now you have two options. You rather know that your customer service and your way of dentistry is going to work, and you're willing to take the loss of $12,000 a month for 7 months, or you become an ethical dentist that is willing to drill whatever comes in his sight. And so if I get a new hygiene on board on the time where I cannot afford to maintain the office, because over every year the fee guide goes up, where we charge a little more
most years, yeah.
but our payment to the loan is the same. So a dentist that is, let's say, a year or two in is not same as a dentist that is 10 years in,
Mm-hmm.
from in order to how strong he can give raises.
Yes.
I see.
Yeah. And that gives an eye opener to like why it depends on where the dentist is in that level.
Mm-hmm.
Yeah. Anyways, I want to reflect shortly about, you guys, you have 2 years into hygiene. You've been a hygienist for over 2 years.
2 years just passed, actually.
That's great.
Yeah.
Yeah, wait.
It was on March 15th.
Oh, wow.
Yeah.
And Sarah, you have
like 3.5 now.
3.5 years.
Yeah.
Yeah. So tell me in a nutshell, in a minute, what do you guys like experienced over the 3 years that you learned about the hygiene in the dental field in general?
I knew nothing. Like, I feel like I was super lost my
Mhm.
first week or so. And I was very anxious. And you kind of just have to wait out that period. And then over time, you get more confident in your abilities and just like more confident in your decision making.
Yeah.
Which feels good. And you feel every time you see a patient, you feel like you're doing the next patient better. And then and then you build that rapport with the patient. And like one of my biggest, I guess, tips for new hygienists is like, it's not just being their hygiene, but like any conversation you have with your patient, like write that down. Anything that they tell you about themselves, write it down. So when they come back, you can ask them about their kids. You can ask them about their mom who lives out of town, who's 96, and they go visit them. You know what I mean? Like, because you build that rapport with them. And I feel like that's what keeps patients coming back, is that relationship. It's like so important. And we see so many people, sometimes you can't remember off the top of your head. Doesn't mean that they're not an important person to you, but you just have to keep things organized,
Yeah.
Sure.
So like I have
you
like
see 12 patients a day.
Exactly.
Yeah.
And it's like a lot of people to talk about a day, and like you want to be able to connect with people, especially like I feel like some people, this is like the only interaction they're having all day, where someone is like really just focusing on them. So I feel like the more time you spend in it, the more you realize that one-on-one kind of connection that you're having with someone is maybe even more like priceless to them than the actual care that they're receiving. So
I feel like with me, like when I first started as a hygienist, is like you finish hygiene school and you're telling yourself like you're supposed to know everything.
Mm-hmm.
You're supposed to go into the field. You're going to know every single medication that sits in your chair. You're going to know exactly what to do if they just had a surgery. You know every single thing. And that is not the case at all. I remember when we were in school, the teachers were like, you need 3 years of like working clinical hygiene for you to feel like fully comfortable. And I 100% agree with that. And even me, like I assisted for 10 months. I worked in the dental office for a year and a half before I even started hygiene, and I still remember my first day sitting in that hygiene chair. I was
Quite literally, you're like,
I was like, what am I doing? And I'm like, this just feels so weird. But I feel like one of my favorite parts of the last 3.5 years is seeing like how far I have come as a hygienist. Like just seeing, like looking back at the first day and till now, I'm like, it's amazing because you like now it's like medications or pathology, all these things that you were doing, perio charting, all these things that you were so scared to do. Now it's like it's so easy, and you
Wait, you're a Lincoln Planets expert.
yeah, I can spot that from a mile away. And you learn, like, throughout these years, you may not want to ask questions because you're a hygienist. You're supposed to know what you're doing. No, you don't. At the end of the day...
No, you don't.
and that's okay.
And that's so okay. And I feel like even as a dentist perspective,
Yes.
you would rather me come to you even 3.5, 2 years down in the line and be like, hey, this and this, what do I do? I give you the right answer, but it's just that reassurance of like it is okay to ask questions, and your boss, your dentist will never look at you and be like, that's a dumb question. Like, thank you for asking. Yeah. Like, thank you for asking. Now it's like, now we can approach this in the right direction.
True. You know, before the podcast, Megan asked me to talk a little bit about the perfect hygienist scenario. To be honest, I worked with a lot of OG hygienists and new graduate hygienists. I find that it's a character. It's not like I cannot judge this person by one patient. You can't judge a hygienist by one patient. It's the same thing when I look at another dentist's crown and I'm like, oh, this crown looks so bad. You don't know how difficult the patient was at the moment. So for me, a perfect hygienist is someone that can be structured and knows how to explain themselves well. Because in our field, if you have these two things, a structured hygienist, I mean, detailed about their work. They care to deliver the best service they can with the patient they can. So that person normally cares about everything else, the way they carry themselves, the way they are clean, the way they are representative, and the way they carry a conversation with you. That tells me a lot about their work, more than how they actually scale teeth, because the patient can be very difficult. Joey, I couldn't get into that angle on the mesiodistal and I didn't clean it because you want to sit in my place? I would do worse work. But I know you as a person, you will do the best you can, so I'm not going to doubt you. That makes me really comfortable. And a hygienist that's curious, that asks the right questions. Don't assume things. Sometimes it's a little bit more complicated. It could be very clear that this patient's taking a blood thinner, that Joey said it's okay, but actually he just had a surgery a month and a half. And they replaced the valve on his heart and needs some antibiotics. It's not attacking the hygienist, it's to understand the consequences you may getting yourself into with the patient like this. So you never lose anything by asking.
100%.
I feel like one thing that people underestimate is like how serious dental hygiene can be. And it can be very serious.
Yes.
Like, you do not want to treat a patient if they have certain things going on. You really have to know. And obviously, there are so many conditions and medications and allergies out there, but that is what you have your coworkers for. You know, like, if you're not sure, ask. Yeah. If you don't know,
or ChatGPT.
Google it. ChatGPT.
Shout
Google
out ChatGPT.
CDHO Knowledge Network. Like, literally do anything. It's never bad to just double check, you know? If you double check and nothing's wrong, like, every time there's a knee replacement. Knee replacement doesn't need pre-med antibiotics for years now. Every time there's a knee replacement, I'm like, Joey, knee replacement. And he's like, you're good. I'm like, okay, cool. And I'm gonna do it.
And it
it's
makes
better to be the safe side.
It just 100%. It's like, okay, I say it's fine, she says it's fine, he says it's fine, then it's fine.
And it makes you feel more confident and comfortable 100% going into that and dealing with that patient.
True.
Instead of like, and once again, there may be 0.0001% chance that it may happen, whatever, but it's just
better to
just
know for
make
sure.
Yeah.
this, yes, perfect. Let's
Yeah.
go.
That's why even as dentists, we make the decision and then we have the pharmacy to double check behind us.
Yeah.
Like today, I got a phone call from the pharmacy saying, "Are you sure you want to give that medication?" Now, ego should never be in the middle.
No.
Because
100%.
at the end of the day, we are here to serve the patient in the best way possible for them.
Mm-hmm.
Yeah. So it brings us to our last interesting point. Your future advice for the younger generation. I'm a hygienist. No, wait. I'm a high school graduate. I just finished 18 years. I'm hyped. I'm hearing the podcast, Tameless podcast. Shout out to Tameless.
Shout out Tameless.
And I got excited. I want to join hygiene. What would you say, like, your biggest advice for them in a nutshell? Megan, you're going first.
Okay, let's go.
I feel
girl.
like Sarah's like, give me a minute. I need to cook
fair
this
enough.
one up.
So, I don't know if you're listening to this tomorrow. I don't know if you're listening to this in 5 years. Do your research like I did. Look up the demand, look up the salary, look up your other options, anything else that you're interested in. And I would also consider the intersection between what you're interested in, what you naturally gravitate toward, as well as what is in demand. So, you want to make sure that you are fit for this profession and also that it's a profession that is going to be there when you're done school. Because I feel like so many people go to school for something that they're passionate about, but there are no jobs, or vice versa. They go to school because they're going to get a job, but they hate it. So you want to find something that fits all that criteria. So make sure that that's you before you jump into it. And I feel like that's my advice.
That's really good advice.
It is.
What do you think, Sarah?
I feel like, kind of going back to like the beginning of the podcast, like everybody kind of comes from different places and periods of their life, and if it's something that you do want to do, same thing. I totally agree with Megan. Like doing your research, making sure that this is something that you will enjoy. This is something you're choosing for the majority of your life, and you want to be able to show up every day at the end of the day, which we all do, and actually enjoy being there, and we enjoy what we do. So
you're giving a shout out to Mersal Dental?
Mersal Dental.
Yeah. So I appreciate the point of view. Anything you guys want to add before we sum things up?
I feel like one thing I do just want to add at the end is that, like, I feel like I said it, but I want to reiterate it, that making sure that you are shopping around as a dental hygiene graduate from office to office and finding something that fits you personally and an office that aligns with your values, because you can go to a lot of different offices and have very different experiences. And and you can cut this if you want. I'm not just saying this because he's sitting here, but yeah, shout out to Dr. Mersal. But there's definitely like the type of dentist that you want to work for that makes you feel like an equal, that makes you feel valued and respects your knowledge and what you bring to the team versus maybe not so. So I would just say, and like even just coworkers, like working with people who don't see you as inferior to them, who want to like work together, it makes a world's difference. Like I get up every day excited to go to work. So
that's good to hear. Yeah. So what do you think, Sarah? Any last words you want to add before we sum things up?
I think
that's it.
That's it. I just want to add one more point is considering hygiene. Do you find it important to kind of have that as a main career? Can do great financially?
So this is actually a good topic, because one thing that I didn't know and they don't really tell you much about is that we don't actually get a pension. So I feel like I remember hearing that for the first time and I was like, oh my God, like, what have I done? But at the same time, it's like so many of us are going through it, and I feel like the money aspect, it is good, and we talked about before, like we jumped in at a perfect time. Like right now, hygiene is making the most it's ever made by a huge jump. So I feel like you are making money to be very comfortable, but you have to just kind of manage it in a way that you do have to realize like you do need to set your life up in the right proper way, or
Yeah.
you're gonna be screwed.
Yeah, so it's important to kind of really invest your
And
money
just
right.
put your money in the right places. Make sure you
Like
know that
Blanca.
Blanca.
Do
Shut up,
you
Blanca.
guys have a stock?
Not yet.
No, not yet.
Not yet.
Okay.
Yeah. And you're so for decompressing and investing in the future, do you have something that like that's your plan? What's your leaning towards to have a balance?
I think that it depends on your approach. So we were talking about this a little bit earlier, actually, where like Sarah, she's working very like fast paced. She's working 6 days a week, but she does have it in mind that maybe she might only get like 15 years max out of the career. I think that if you scale back and have like a side hustle, or even if you just scale back and I will say, working 4 to 4.5 days, I can make a comfortable living. You know,
Yeah.
like I don't have to really worry about bills. It's a very profitable industry. It's like one of the best decisions I've ever made. It's like more comfortable than I've ever
You
dreamed.
heard that your first best decision she ever made,
Yeah.
becoming a hygienist, working for Mersal Dental, is gonna happen.
It's genuinely like more comfortable than I could have dreamed that I would ever be in my lifetime, especially coming from like a lower income family. So for me, like I'm already living my dream of like not having to worry about like it's not paycheck to paycheck, just like being able to kind of do what I want. I pay my bills and it's comfortable, and I see like a clear path moving forward. If you are dreaming of more than that, that's great. But I do think that in terms of physically the demand, and even like a lot of hygienists experience burnout. So I think that you either have to strike that work-life balance of scaling back, working a few hours a week or like shorter hours a week, and then having a side hustle if you really want to grind. Or you can do what you're doing where you're putting it in 100% for a shorter time and then kind of pivoting to something else, whether that be business, or some hygienists will go back to school and then teach.
Yeah.
I know when you have a certain amount of clinical hours in,
Or
you can
do more
become
Pilates
clinicians.
time.
Yeah. Maybe
Maybe in the
Pilates
future.
studio.
Maybe
You never
maybe
know.
we get certified. Maybe there's a Mersal Pilates studio.
There you go.
Who
Yeah.
knows?
In our future.
You never know. So Sarah, what's your thoughts? Final words that you want to say? You're just living. Let's go.
Sarah's just a happy girl.
I'm just right now. I feel like
Side hustle. What are you doing
Side-
for you to kind of? You said 15 years. So what's the plan?
You have to plug Blanca. That's your
Yeah.
baby.
Yeah,
I
Blanca
feel,
gotta
I
grow.
feel like
Yeah?
like right now I'm all about like doing more. I'm always like open to like starting a new project, learning about new things. I'm so curious about everything, and I'm business, whether it's going and buying your first home, like all this stuff is kind of what's going on in my mind right now, and I'm just that's kind of the path that I'm taking right now.
Yeah. Of course, we're gonna talk more about Blanca. That's a whole nother episode that we'll be
Stay
doing soon.
tuned.
Thank you so much, guys, for listening to Tameless podcast, and thank you, Megan and Sarah, for sharing
Thank you.
amazing information. It was an eye opener for me too. I learned a lot today. So
Good.
much. Thank you so much, guys,
There
for
we go.
joining me for this
Thank
episode.
you.